back of the legs, we've stretched the inside of the legs, and we've stretched deep in the hip. Now I need to stretch the front of the leg, or the quadriceps group. So I'm going to move to the side of the chair and have one cheek on the chair and the other cheek off. So one buttock is on the chair, I can feel my hip bone securely on the chair, and the other one is off. To stop myself tipping over on the leg side, I'm going to hold on to the side of the chair. Now I need to grab my ankle. This isn't always easy. Sometimes people have got the strength and the flexibility to bring their ankle up and then through. Some people don't. So the best way to approach this is to put your foot on the chair in front of you and grab the ankle, and then see if you can bring the ankle through to where the knee is pointing roughly in the direction of the floor. At this point you might feel quite a strong stretch on the front of the thigh, and that's what we're looking for. So the same principle applies. I'm trying to relax my shoulders as much as possible. I have energy in my hand because the hand is holding on tight to the ankle. And if I want more stretch, I push the knee back behind me. Feel the tree behind me with my toes. Okay, so I'll be holding this for about another 30 seconds. If this is too much stretch, then just bring it back a bit. If I feel the muscles begin to relax and give, I can push the knee further back. I can bring the foot up closer towards my cheek and push the knee further back. Some people think this quadricep stretch is much more effective than the one that we do on the floor, and that's because the muscles nearer the hip are stretched. When we do it on the floor, the muscles nearer the knee get a good stretch, but not all the muscles in front of the thigh. So I'm not going to just let my ankle go because my toes will rattle against the floor. So I bring my ankle through and then put the foot down. I'll move across the chair so that my other cheek is off the chair. Now, if I'm going to find it difficult to reach my ankle, if my mobility is such that I can't reach stuff like this, I can use either a towel or a belt to hook under my ankle and then hold and then bring my ankle through, so I can get some kind of stretch on the free side that we're trying to stretch. If this is enough for you, that's fine. Just be aware that your shoulders and your arm will be quite tense. But if you want to shorten things off, then there'll be less of a lever working there. Okay? So again, I've got my hand on the side of the chair to help me tipping up, stop me tipping that way. And I'm going to hold the stretch for roughly a minute. If I want more stretch, push the knee back behind. Remember to keep breathing, or try to remember to keep breathing. Relax shoulders and monitor the feeling in the muscle. If you want to, breathe to the stretch and then bring the ankle up and place the foot on the ground softly. Okay, so you've seen the normal grabbing the ankle and then the assisted. That could quite easily be a belt with the buckle done up that you hook there. The next part of the mobilisations are for the thoracic spine. That's the bit of the spine in between the shoulder blades. It's the least mobile part of the spine and so requires quite a lot of work. In modern life, we're quite often hunched, looking at iPads or mobile phones, and we rarely stretch the spine the other way and we rarely rotate it. So this next practice is to mobilise the thoracic spine. I'm going to grab the corner of the chair in front of me, or the corner of the back of the chair. I'm going to take a deep breath, and then I'm going to breathe out, pushing the middle of my shoulder blades towards the floor. And I'm going to come up. I'm going to do that between 3 and 5 times. You may feel a crunch or a crack, that's fine, as long as it's not followed by a yelp or any pain. It's normal for the joints to release. That's 3, I'll do 2 more. If you want more stretch, you can put the hands just in front of you like so. come up. Always coming up using our core. You should never be leaning on the small of our back. Now I'm going to add a slight rotation from side to side. So I'm going to reach over and grab the corner of the chair opposite the side I'm working on. We always work to the left first. So I'm reaching that way and I'm going to push my armpit towards the floor. And come up, and I'll swap. So this is stretching the muscles in the armpit, so the latimus dorsi and the intercostal muscles. But it's also adding a slight rotation to the thoracic spine, which is good for it. You can see I'm using my free hand as a counterbalance, which adds some more rotation. You can do just the same thing by putting your elbow back. So I'm doing 3 to 5 of these each side. Always breathing out as I push down. And coming up using my core. Good. Now we're looking for a pure rotation in this part of the spine. In reality, the lower back will do most of the rotation. I'm going to put my palm away from me. My fingers are pointing towards the left. I'm going to grab the chair on the side or the back of the chair, and I'm going to follow my fingers in the direction that they're going. Gently breathing out as I move to the side. So I've swapped sides, the other hand is in front, palm is away from me, thumb is down. I'm going to follow, my head and nose will follow the fingers in the direction they're going. And I can add some additional rotation by pulling on the chair. This should be a gentle turn. There shouldn't be too much power employed. If you feel a crunch, that's fine. If you feel any pain, stop and unwind. I think this is 3. And I'm beginning to loosen up because I can feel that I'm going further round. Okay, so that's 5 each side, or roughly 5 each side. The last in this set, because we can't do rolling, we don't do Koho Tento Under when we're on chairs, the last in the set will be as if we were sitting cross-legged. So I'm going to go back to one foot on the floor and the other foot crossed over. Now, so it's more like sitting cross-legged. I'm going to bring my foot further up the thigh, and I'm going to lift my centre and move my centre over the front of me, not the middle of my shin this time. I'm going in this direction. I'm feeling a stretch deep within the hip that is slightly different to earlier on in this set. I'm trying to relax my shoulders and my arms, although my hands are alive. I'm forgetting to breathe, so take a few deep breaths. And I can wobble from side to side, just like when we're sitting cross-legged in the adapted classic. When I've done my minute or my 2 minutes, come up using my core, gently put the foot down, raise the other knee, bring the foot over. Now, if we can't get the foot higher up, then let's put the foot where we can. It's okay if it's here, but our centre is coming up and over in this direction, not through the middle of the shin. It's forward. So we're lifting centre up and moving forward. So I'm breathing to the stretch. I feel as if I'm tighter on my left side than my right, and that's normal for me. I'm not competing with myself, I'm not competing with you, you're not competing with me or yourselves. We come back to these again and again, and every day is different. Slight shake from side to side, bit of a wobble, that's okay. And come up using the core and gently put the foot down. Okay, so that's the end of the adapted chair-based Makko Ho.